The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. Today we're going to be talking about the coronavirus. Now, the outbreak of a novel coronavirus in China and its spread to more than a dozen countries has presented health experts with quite a challenge. And our guest today, Dr. Xiao Mei Zeng, is going to speak about it because she knows a lot about it. Now, just to give our audience a little bit of an understanding, Dr. Xiao Mei Zeng is an obstetrician gynecologist in Boca Raton, Florida, and is affiliated with multiple hospitals in the area, including Boca Raton Regional Hospital and the Bethesda Hospital East. She received her medical degree from New York Medical College and has been in practice for 20 years. Welcome to the Susan Brender Show, Dr. Xiao Mei Zeng, and I want to really tell the audience that you are an amazing person, and I speak from my heart because you are my personal doctor, and I'm very pleased that you want to talk about this crisis that we're going through. Now, to begin the show, considering that coronaviruses can technically refer to illnesses ranging from the common cold to something as serious as SARS, what makes this particular coronavirus strain significantly concerning?
The coronavirus, we also call COVID-19. It's an incubation period. It's long. It could be from 2 days to 9 days and possibly 14 days, and some people even mention up to 28 days. And the coronavirus is very infectious, and it has infected many, many people around the world. We're talking about 75,000 people in China. We're talking about in Korea, 3,700, and Italy, 3,150. Iran, more than 1,000 cases, and all around the world. And these viruses are possibly transmitted initially from animals, maybe bats to human, and then the human to human is airborne. And the symptoms could be very similar to the common cold or flu virus.
Right.
They could be from coughing, and 87% may present with fever, and 67% presents with dry cough, and 37% presents with fatigue, and 33% presents with phlegm, short of breath, and headaches, 13%, myalgia, which is aches and pains of the muscles, 15%, and chills, 11%. Some people have stuff in the nose, diarrhea, 3%, and nauseous, 5%, and some blood in the sputum, blood in the eyes, very small amount, 1%. So it's very difficult to differentiate from the common cold as well as flu-like symptoms.
Yeah.
And it's highly infectious.
Yeah. What do we currently really know about this human-to-human transmission of this novel coronavirus? The news has been talking about it, and they've built it up, and a lot of people think that they're making much to do about it, but I'm just curious from your point of view whether that's true. More specifically, once one person is affected, does the coronavirus appear to be significantly contagious in a human-to-human context?
It is contagious from human-to-human contact. So what we need to do is, what happens is most of the people they may have light symptoms, 80%, and like I said, 2 weeks incubation time, and they have light symptoms. And 13%, first of all, going back, 80%, not 18, 80% having light symptoms. And 13% have severe cases. And the recovery time could be from 3 to 6 weeks. And only 6% have very grave disease, which represents with respiratory failure, and sepsis, and multi-organ failure. And death rate in the roughly, depending on the area, and initially in China is 3.8%, and now it could be quoted as 2%, 0.7% to 2%.
Wow. How does one protect themselves?
It's very important that we take precautions. I had a friend who just went through customs from Shanghai, going through customs in America. And he was asked, where are you from? Which city you're from? Have you ever been to Wuhan or Hubei? That's the epidemic area of the disease. Do you have fever? And then they want his contact number in America and email address. And they asked him, are you in contact with the coronavirus patients? And so he was given a brochure. One side is English, and the other side is in Chinese. And he was told to check his temperature twice a day for 14 days. If temperature is greater than 38.6 degrees Celsius, you need to contact the hospital and wash your hands. And there is no need for quarantine. So this is at our border that the Homeland Security people inform these people who are from China. So, but I think after I've been basically following the coronavirus from right before Chinese New Year when Wuhan was quarantined. And I have a patient over there. She's been quarantined for over 5 weeks already. And she and I in contact. And she actually, her family, her husband is the owner of a factory making masks as well as the protective garments. So, but they are staying in the house. They can't leave. They can only send one person every other day to fetch the vegetables and groceries. So it is very severe over there. And however, by quarantine, Wuhan City and some epidemic area or endemic area of the region, China did a great job to prevent it from spreading quickly. Yeah. However, quite a bit have been spread all over the world, as we just talked about.
I know. You know, Dr. Zeng, how are the symptoms of this novel coronavirus different from those we associate with the common cold or seasonal flu? Is there something that presents itself in a different way?
Yes. The coronavirus are very different from the common flu, common cold, which is cough, sneeze, and a sore throat, something like that. And the flu, usually you have fever, myalgia, and but this one is very severe. It does have upper respiratory symptoms as well as lower respiratory symptoms. So this virus attacking the protein in the body called ACE2, and it attacks the upper respiratory by what we just mentioned. The coughing, the sneezing, the fever, chills, and the headaches, myalgia, but also attack the lungs. And a lot of these patients in Wuhan, they are having no symptoms, and all of a sudden they have this high fever, and they go to the hospital. Mind you, the hospitals in China or in Wuhan are very deficient in taking care of these patients because there's so many abundance of patients waiting at the door. They couldn't take care of everybody. So the CAT scan was performed on these patients. Some of the grave cases we talk about, their lungs are initially a little bit, one lung become whiter on the CAT scan than the other, and then the whole lung become white. So you cannot breathe through the alveolus and the bronchioles and things like that. And people do die because of respiratory failure. And by autopsy, these patients have mucus or pus in their lungs, and it totally blocks the area of the lungs. And by ventilation, you just can't suck them out. So I think that we do need to take things seriously. Like I said, not many people will become very, very sick because most of the people, 80% are okay. However, the sick ones need to be taken care of. Those are the 6% of people who present with respiratory failure, sepsis, and multi-organ failure.
I see. How do we get our state or local health departments involved in this? Because the way you describe it, it is a crisis, and it is something that needs to be identified. So I'm just curious if you, as a doctor who have some influence in, really seeing what's going on, tell the people in the government we have to do something. So how do we get them involved, though?
I think most important is that we need to let the government know. We're having an election right now, but the elected officials need to understand this is a public health crisis. We need to have strategies to take care of this virus. And it's just like President Donald Trump has ordered that we need to produce many, many masks and the protective wares as well as testing kits. And so because in Wuhan, what happens is one person have fever and then they go to the hospital every day and to be tested, and they have fever, they have CT scan, but the test kit doesn't show positive until they're really in grave area. And then they end up with that. So we need to really control this situation and learn from the Chinese, the lessons from China, so we will not get caught in, behind the eighth ball here.
Yeah.
So we need.
Go ahead, please finish.
We do need the hospitals informed about the coronavirus, and we need to have emergency teams, not just the ER docs or the clinics, outpatient clinics, right? And such as now. And we need to have teams. Once we identify coronavirus, we have to identify the people who they're in contact with and put those people under quarantine. We have to follow the trace, identify those people. Those people need to be quarantined and being checked for the temperature and everything. And people are not usually very self-disciplined. I myself know some people, like in my office, people will get out. When they come from China, they're supposed to be quarantined for 14 days, but they don't want to do that. They came to my office for a physical checkup at 12th day. We said, no, you have to come back in 14th day. We're not going to take care of you, right? So once we identify a case, we have to follow through and see some of these people are super carriers. And I think somebody from Italy, he went to the marathon, half marathon. He went to the football game. He went to get gathering with other people. And one patient in Wuhan, he was tested positive. He went to the family gathering, and with thousands of people, the town gathering, thousands of people, 3,000, and then he went to a wedding. He himself infected 4,000 people. So we really have to do some detective work to find out who these people are in contact with.
Yeah. There's so much speculation and there's so much controversy over this particular virus. And because, if you really, and this is not your specialization or your field, but, people say, well, perhaps the news is making more out of it than they should. They love good stories like this. It's a very sensational story so that people are attracted to listening and getting very frightened as a result. Then there's the other side of the coin, which is that people will say, well, I have to say, we're in
the U.S. There's not many cases in the U.S., so we don't have to be as scared as they are in places like China and places that are close to China, like Thailand or Vietnam or places of that nature. What would you say to that? Because it sounds like when you're talking about it that it is something that we need to be involved in and understand a little bit more about. What's your thoughts on this?
Okay, I did try to differentiate the customs between China and the United States. The customs in China, the COVID-19 virus happened in China at the most inopportune time, which is Chinese New Year, and right. The whole country took 2 weeks of vacation, and everybody who are from outside there, say if you are working in Beijing and your hometown is in Wuhan, you travel thousands of miles to go visit your family and relatives. This is like the Great Migration. So, and then they go visit their family. Of course, they share food. Chinese people love to share food together with a big family style, and they eat the hot pot, where it's a big hot pot with the food put in the pot. Everybody put their chopsticks inside and dip it in and put it in their mouth. That's a great way for the virus to get spread. The benefit we have over here right now, we're not in Christmas or Thanksgiving. We don't have a huge migration of population. That's good for us. And number two, our eating habits. And most of the people in America eat your own meals. The share meals is not common, but even with share meals, you have a common forks and spoons or knives, so you do not share that with another person most of the time. Although in some cultures, sharing food is more common than others. Mm-hmm. And although there's one deficiency for I live in Florida, a lot of Hispanics, Italians, and French people. People tend to greet each other very closely, meaning not just shaking hands, kiss the cheek one side and the other, the coronavirus spread, the distance to prevent coronavirus spreading, it's an arm length, which is like 2 meters. Okay, but when you started kissing people left side and right side, and then of course the airborne viruses will get to you faster. So we have to change the habits of greeting people by just simply nodding or put your hands together or even elbow touch as greeting instead of a closeness of touching people. Mm-hmm.
Yeah. What about kids? Because needless to say, kids are pretty, how should we say, they share everything. I mean, they touch each other. I'm even talking about like kindergarten or under kindergarten, preschool. When their nose runs, they wipe it on their hands, they wipe it on everything around them. And I would imagine that children could be a real great source of spreading the virus. Have they seen that in China as well? Are children...
Actually, I think the spread among the kids is less. Number one, because of this Chinese New Year, a lot of families take the kids out of school. So there's no school. In China, there's no school until March or April, like middle of March or April. So the kids are not in the contact environment. And most of the people get affected in this COVID-19 virus are the people who are elderly, like people who are 60 and above, and somehow more common among males than females. And the kids can get it infected. Maybe it's because the kids are not in school. And, of course, quarantine, meaning that separate the kids. The kids don't have school, and the quarantine the cities prevent the spreading among the kids.
Right. And what about the fact that they're quarantining people on cruise boats? And as a result, the economy is really suffering a lot. And, this is not necessarily up your alley, but look at what's happening with the economy. It's really affecting it. In addition to which, it's also, I'd like to hear your answer to this.
The situation with Diamond Princess cruise is that one person got on the ship from Hong Kong and got out, and this person was affected. Instead of quarantining the people or testing people appropriately, I think Japanese government did not move fast enough to test the people fast enough. And so the people who are virus carrying are mixed with the people who are not virus carrying.
Oh.
And then, in addition to that, people are in very small quarters. And just bear in mind, this ship has 18 stories with a central air conditioning. And this air conditioning is not circulating outside; it's circulating inside the ship. So, we've seen that from SARS virus in Hong Kong. Somebody, say, from the story, say, 2, who had SARS virus can affect somebody who's on story 19, just because of the drain situation. It's going from the lower floor and going up floor, or vice versa. So it's going through the drain, and there's air holes in your bathroom, and affecting the people in the building. And so same with this coronavirus with Diamond Princess, is that when people are put in the small areas, even some of the balconies don't have the window open. They can't open their window. So you're in a closed environment, and this virus containing air was circulating again and again, so that infect quite a bit of patients. I think maybe more than 500 people were affected out of 3,000 people, including the cruise. So it's pretty serious.
That's what I was curious about hearing, because a lot of people have misconceptions. Some people say, oh, my God, is this dangerous? We're really scared. It's going to spread, and it's going to create quite a crisis around the world. And others just sort of say, well, maybe the news is making much to do about it, and I don't have to worry so much. But it sounds like you, Dr. Zeng, don't agree with that. You feel that there is something going on, and we have to be very cautious and very concerned about preventing it. And I want to give you the last word, because obviously you know a lot about it. And what would you tell our audience? Let's leave them with these words, because we need to focus on things that really can be hazardous to our health. So what's your last word about the coronavirus?
The coronavirus, it is highly infectious. And we're lucky the fact that our border was closed very quickly, so we did not let a lot of people coming in. And it's a novel virus, so it's very important that we follow the instructions by CDC. Number 1, include hand washing. Number 2, include when you sneeze or cough, cover yourself with elbow, and watch your temperature. If you're having cold-like symptoms, watching your temperature and coughing. And, we need to change the social habits. Instead of shaking hands and hugging and kissing the cheeks, we need to keep people at distance, at least arm's length. And also, we need to help the elderly and high-risk people. High-risk people includes people who have high blood pressure, diabetes, heart disease, immunosuppressed patients, and HIV and transplant patients. And so we have to share our information with other countries, learn from other countries, so we don't have to repeat the mistakes that other countries made in this country.
Wow. Well, you've been very informative and very offering a lot of understanding about this particular virus, which, we're hearing so much about, and that is affecting our world in so many different ways. So today our guest has been Dr. Xiao Mei Zeng, who's an obstetrician gynecologist in Boca Raton, Florida, who really understands what we're dealing with and tells everybody all the different advice that she gives. Listen to it very carefully, follow her advice, because this can be a dangerous thing. So thank you so much, Dr. Zeng, for being on the Susan Brender Show. It's been a pleasure, and let's do another show again. So I appreciate your information. Thank you again.
Thank you, Susan. And also just want to let you know, I studied this from the World Health Organization, their study on COVID-19. On the study in China. Thank you. Appreciate your
Thank you very much.